subscribe now and press the bell icon. Never miss an update.
Welcome to Health Live at Seniors today. We are delighted to have here once again, and we welcome him back, Dr. Chintamani Pant, a leading dental surgeon. A little about Dr. Pant. Dr. Pant is practices in Mumbai, in Colaba. He's a graduate from the DY Patil Dental and Medical College in Navi Mumbai and has a master's degree from Sydney in Australia. Dr. Pant has done oral implantology, advanced surgical courses from India, Portugal, Korea, Germany, etc. He has trained and studied lasers in dentistry from biolase in Australia. One of the few dentists who use a hard and soft issue laser machine in regular practice. Welcome to Health Live at Seniors today, Dr. Pant. How have you been?
I've been good. Thank you, Mr. Pradyuman. It's good to be back. It's been a while. Time's flown by.
Yeah, you were here with us in July 2020.
That's right.
And, we had just about recovered from the first phase of the pandemic at that time. That's right. Since then, how's been the journey? You know, we've experienced three phases of the pandemic, and healthcare has come to the fore virtually since then.
Right.
It's uppermost in people's minds.
That's true. In fact, the pandemic has raised a lot of insight into people, and for them, the health becomes more of a priority. There have been just so many questions by everyone regarding their health, and they've had an insight among them, their own lifestyle, to see upon how things are going for them.
Yeah, and how's been the journey for you over the last few years? Post-pandemic. I know at that time when we spoke last, the whole concern was visiting a dentist.
That's right.
At the time of the pandemic, and
that's right.
And of course, you're underscoring the fact that we are taking care in clinics, etc., etc. So, has that reduced now? I was in public areas, nobody is wearing a mask really. So
Yes.
have things improved now for y'all?
Things have improved in the sense that during the pandemic, we were serving people who really needed immediate treatment anyways. But at that time, we were sanitizing the individual coming to the clinic as well. But sanitization in the clinic has always been a protocol. So that still continues, except for sanitizing the individual coming through. But otherwise, the sanitization in the clinic has been always as it is. So that's not really changed. People have started wearing the mask back again. So in one way, that's good, I think, because of this latest scare that's happening in China, and probably expecting it to come to our country. So I think people are being a little more cautious than what they were before. And then quite a few don't want to take a chance. Of course, yes, in public spaces, still we see people not wearing the mask. Probably with the boosters and the vaccination they've taken, they just think probably it's not going to really affect them.
Yeah, let's hope the right care is taken by everybody.
Yes, that's very true. They got to be cautious. They can't. We shouldn't actually leave our guards down. Still need to be a little cautious.
Right. Thank you, Doctor. There are a few questions which are COVID linked, which I will raise with you once we start.
Sure.
But over to you, Doctor. For a few remarks on dental care for seniors, and then we'll get down to questions. Those of you who have questions for Dr. Pant, please put them on the chat in the Q&A tab. As always, mention your age and your gender so that Dr. Pant could give a more considered reply. Over to you, Dr. Pant.
Thank you, Pradyuman. Good evening, everyone. Good evening. This is Dr. Chintamani Pant. I am a practicing dental surgeon in Colaba, in Mumbai. And I'm a second generation dentist in the family. My father has been practicing for over 50 years at the same place. And now I'm trying to fill in his boots and take it further. I've been practicing with a lot of seniors, a lot of implant work, a lot of denture work, bridges, crowns. These are just regular things that we keep doing in the clinic. Um, we do come across a lot of questions and a lot of obstacles for seniors where um, health becomes, general health is main priority, and that affects the oral health of an individual. At the same time, we at this stage in life have mostly undergone quite a bit of dental work. We should have had maintenance done. It's very important to keep everything maintained and looked after, even though the dental treatment has been carried out. And it's utmost important to maintain oral health in general, because there is a connection of oral health to your general health. So it is very important that we should know and take some tips upon how to maintain our health. We'll start off with some problems that we face as we see senior citizens. The common problems are something called as xerostomia, which is basically dryness in the mouth. So dryness in the mouth is an age-related process. It just happens as we grow older, and more so as we grow older, there are more medical problems that we come across. Uh, One goes through, and that leads to taking up a lot of medicines. Having taking these medicines do have some side effects. These side effects are quite visible in the mouth. For example, there are iron supplements, there are multivitamins, there's homeopathy. All these things can cause staining in the teeth. That's one problem. People think that the stains can be brushed off, so they tend to brush that much more harder, which basically starts wearing off the enamel. So the sensitivity comes into play. Then there are patients who have a subconscious habit of clenching and grinding their teeth. So because of which the teeth start wearing off. And once the enamel layer starts wearing off, the teeth start getting a little sensitive. When not looked after and the habit continues, it's something that is brought to your notice by someone uh, close to you, or then your doctor or your dentist, when he checks you out, he can pinpoint and tell you that you are subconsciously clenching or grinding your teeth, which should be corrected, which can be prevented. And there are little removable appliances that one wears that is like a guard to the teeth, and it protects someone from a heavy bite or further erosion of the enamel. The medicines and the drugs that one takes for multiple health issues, they cause a lot of different problems. For example, they have these are drug-induced dental problems. For example, inflammation of the gums, which is called as gingivitis. It could be just locally around a couple of teeth, or it could be just generally in the whole mouth. At the same time, then you have diabetes. Diabetes is very directly connected to our gum health. So diabetes, basically, everyone is aware that it causes delay in healing. Our body somehow regenerates healthy tissue once it's corrected, and it maintains it in that particular state. But due to diabetes, due to a high sugar level, uh, it does not really help in maintenance, because it just keeps deteriorating further. Such patients should not they should basically go and see the dentist more often, at least once in 6 months, whether you have a dental problem or not, because the dentist is the best person to guide you and to show you upon what problems are occurring in your oral health, and they will guide you properly upon how to maintain it. uh, Also, gum related problems means there's a lot of bleeding. There are quite a few senior patients who come in and they say that they've just been having bleeding gums. Now, these bleeding gums are happening because of gingivitis. Gingivitis is something that is inflammation of the gums. So whenever we brush or whenever food gets stuck, it's going to cause some inflammation in the gums. food getting stuck is a very, very common problem. It's a common problem because there are contact points which are open. Gums are receded as age passes, and everything starts opening up. The whole body has a complete change as we progress in life, and due to which the mouth takes a lot of change as well. As soon as we have gaps between teeth, food starts getting stuck. Dental problems are such that you can't really know it till it starts bothering us. So a lot of patients come when it is quite late to do any kind of big work. Till they don't have a problem, they don't want to see the dentist, or they avoid seeing the dentist rather. Nobody is really happy to see the dentist very often. That's a notion, but it shouldn't be so. And there are quite a number of treatments that can be done. There are caps, there are crowns, there are bridges that can be put to try and close these open spaces. However, maintaining these spaces, whether you close them with caps, fillings, or crowns, maintaining them is of utmost importance. Receding gums is a big problem. Receding gums could happen because of bad brushing habits. Some people brush very vigorously thinking that they are cleaning the teeth that much more, while scientifically proven that the more you brush vigorously, you're wearing off your enamel as well as part of your gum. So once the gum starts receding, it's never going to stop. Whatever is lost in our mouth will never regrow. So enamel is something which is very important. It gives us the shine and luster. It gives us the strength. And a healthy enamel would keep any of our cavities away. So the chances of decay is a lot less. In seniors, taking a lot of medication, the calcium reduces as age goes on, plus the side effect of the medication. Lesser the calcium, lesser the fluoride, more chances of you catching decay or your teeth weakening. Also, a lot of dental work that is done in people, for example, caps and bridges and root canal treated teeth, over a period of time, they have a shelf life where at one point they will start giving trouble, as in because of gum recession, things start accumulating and creeping into and leaking into your existing fillings or your existing crowns or caps, and that may weaken the tooth under it, and because of which the neck of the tooth can break, and that is the point where you lose the tooth, because once the neck breaks, then it's very difficult to get the tooth back in place. So you go in for an extraction or then plan to replace it in any other way. Your dentist will check it out and he will be able to tell you the best way to have it replaced or have it corrected. Also, we tend to pick up a lot of acid reflux, acidity, and we do see a lot of patients with an acidity problem, which is a very common problem since we love drinking a lot of tea, and a lot of acidic drinks lead to that systemic problem. How why is acidity so important is because it comes from our stomach. Wherever there's acid reproduced, it comes back in, mixes with our saliva. Saliva is 24 hours in touch with our teeth, because of which at one point they start breaking down our teeth. They become weaker, they become smaller, they become brittle. And our bite being as hard as it is, uh, it, biting anything hard upon them could tend to break our teeth even further. So having an acid reflux problem should be looked into, and it should not be neglected. It's a very important thing that we need to get this checked and have it in control. Acid reflux is something that you may not be able to correct or overcome, but we need to make sure that it doesn't increase or get worse. So have it checked. It's a very important factor to maintain our oral health as well. Coming to women, aging women going through a menopause, they have shown a lot of dental problems because of such a phase that they go through. Unfortunately, it's natural. You can't really do much about it. At such situations, you must visit the dentist often to make sure that you're not going on the wrong path. Um how do you tend to take care of our teeth? Once all this work is done, how do you maintain them? How we should emphasize more upon maintaining all the work that is done so that no more work uh, could come by. This is done by proper brushing. You got to brush as gently as possible. There is no, it's a myth that the harder we brush, our teeth will get that much cleaner or better. It's a myth. It's not true. You need to be as gentle as you can. It's like brushing paint on paper. The harder you brush on paper, the paper will tear. Similarly, as you brush harder in the mouth, your gums are going to take a beating and they will recede. They will get damaged. Your teeth and your gums basically are the foundation of your mouth, and that will start deteriorating. You need to rinse really well. The force of water while rinsing trickles between our teeth, our contact points between teeth, where food gets stuck, caps, bridges, all these things, water pressure will help in cleaning. There are flossers, there are water flossers that are used, and they really help in maintaining these open spaces, rather, contact points where food does get accumulated. Um, Massaging your gums with your finger, just a plain forefront finger along the side of your gums from all the four corners is very important, because there are some corners where your brush does not tend to reach, and those teeth will not get cleansed at all. So rinsing one will help you over there. And second is massaging your gums. Very, very important. Any kind of gingivitis or gum inflammation that there is will definitely reduce, and it will be kept in check by yourself. And then whenever you see a dentist, he will also look into it and guide you through. Also, flossing is a very common practice. It should be done. It should be done when food's definitely getting accumulated, and also to take care of plaque and tartar. Plaque and tartar is something that grows inevitably in every human being. There is not a human that will not have plaque and tartar, and maintaining this at a later age is definitely important. So please do use floss sticks, floss threads. You could use something called as interdental brushes or interproximal brushes. And these are small little tiny bristles on a stick, and you can put them between contact points and clean these areas where probably a floss is also difficult to reach or your brush is difficult to reach. These small little picks will help you. But please do not use a toothpick. A wooden toothpick or a plastic toothpick should be totally avoided, because they lead to septic or some kind of an infection in the gums, because we tend to dig that much more deeper. So please be a little careful and fight the temptation of using a toothpick. We also at one point start having teeth extracted for any given reason. They got decayed, they were uh, in a state where you couldn't do any work on them, and they had, or broken teeth, and you had to have them removed. Please do replace all missing teeth. By nature, we've had a reason to have these teeth. Each tooth has a different function in the mouth, and there are 32 of them with different reasons and different functions. Wisdom teeth are not so functional, but when they are there, they should be looked after. Also, when you have missing teeth, eating becomes a problem. You probably have got used to it after a point, and some people feel that they're eating very well and they're eating just as they should. And but naturally, you're not really chewing your food well. It's not getting digested. It's not getting masticated properly, and that leads to systemic problems. It leads to indigestion. It leads to a bolus food going into your system, which is not very healthy. Uh, Missing teeth should be replaced. I do emphasize on it. There is no reason why you should not replace missing teeth or have spaces. Wherever you have spaces of missing teeth, all your other teeth will start migrating and opening up to try and close that space. Again, then the problem of food getting stuck, spacing between teeth, aesthetically and cosmetically, they don't look good. And it's not very nice to have empty spaces in the mouth. You can replace them by implants. Implants has become a very common practice now. There's been a lot of awareness with people with dental implants, and because of which they are quite at an advantage with a solution like that. While as earlier, before implants, we would do bridges to bridge missing teeth with the help of taking support from the adjacent teeth. The drawback in that practice was, or still is, that you end up trimming your natural healthy teeth where they should not be. And we need to try and preserve our natural tooth structure as much as possible. There are instances where implants are not possible because of the bone health or patient's general health, which does not allow us to do dental implants. For example, someone who's got severe diabetes, the sugar levels are really high and it's very difficult for them to maintain. Some patients who may not be very keen on maintaining it, they don't end up doing what they're supposed to do. And such cases, it becomes quite difficult or rather impossible to put in implants. It's not right. It's not, I don't know, I can't put it the right way, but it should not be put in a case where there is severe diabetes, because then the bone is not going to accept the implant. You have options of making bridges then. In such a case, if bridges work, then please make bridges, or then you can even do removable dentures. So these are little clips of how many ever missing teeth you have, and that replaces your empty space. So you can eat, drink everything with it as you would with your natural teeth, but it is an option available and it should be taken if that is the scenario. People who have all the teeth missing, they should get their dentures made, because over a period of time when you don't have your teeth and you still try to chew on it, you lose bone. It's called as bone resorption, which makes it very difficult for one to even later on in life make any changes in it. You can't regrow the bone. Once it's lost, it's just lost. So please, I request anybody who is sitting with missing teeth, they should consider replacing their missing teeth. However, even if it is one tooth or multiple teeth, please do go ahead, consider options with your dentist upon how to replace these missing teeth. Should, to maintain all of this, eat healthy food, eat fiber-rich food. There should be good mastication. You've got to chew really well, at least make sure that the food breaks down before it goes down to your system. The more you chew, the better for our facial muscles, the better for our digestion, and also there will be less food that gets accumulated. Coming back to food accumulation, because that is one of the most common problems people face at a senior age, also is when they wear dentures. There's food that is inevitably getting stuck, that goes under the denture plates and it sticks around over there. Patients get used to it, and but they tend not to clean the dentures as much. Dentures should be removed after a meal, they should be washed, and they can be worn back again. In the nights, please remove your dentures and sleep. Do not sleep with your dentures on, removable dentures. And whenever you remove them, it should be kept in a bowl of water. They should not be kept dry. And you can scrub your dentures, brush them every day with your normal brush, and then wear them. And whenever you put them, remove them, please keep them in a bowl of water. Never leave them dry. They could warp, and the slightest of the warp or the change in the denture will not fit properly, and that starts hurting the patient that much more. So that becomes quite cumbersome to the patient, and it becomes quite painful. So please do maintain your dentures well, keep them clean, and brush them every day. Just as you brush your teeth, you should brush them twice, and more so because food gets stuck, you should do all the work that's necessary to keep it clean. Apart from that, these are missing teeth options that we have to replace. And rinse well. You can use a mouthwash to keep your mouth clean. Chlorhexidine is a med, it's an ingredient of the mouthwash, which helps in maintaining your pH balance. Helps in maintaining your saliva balance. So there's good bacteria, bad bacteria taken care of, and you should consider using a chlorhexidine mouthwash. Apart from it, I think I have covered mostly what senior citizens go through with their dental health, and I'm trying to emphasize more upon maintaining whatever dental work has been done, the history of work that is done, and you should visit the dentist as often as once in 6 months or at least once a year. But please do not hesitate on visiting the dentist. If there is no work to be done, your dentist is not going to do anything, but at least you'll have a professional look into it and make sure that everything is fine. So I wish you all the best, and I'm kind of done with my topic for today. I hope I have covered enough, and I'm open to take any questions if there are.
Yeah. Thank you very much, Dr. Pant, for this very detailed explanation. Obviously, it shows, normally we do have PowerPoint presentations, etc. But the fact that you've engaged our audience, who's there right now,
I'm glad.
It just shows that your expertise in it. Tell me something, Doctor. Just as an aside,
sure.
Your profile of patients who come to you, people who come
Yes.
to you, what is it between how many seniors out of say in terms of percentage?
So I would say around 60 to 70% of our patient clientele is more so senior citizens, and they all are from the age group of say 60 to 85s. I've even treated someone who's 88. There are patients who are bedridden and they can't really do much, because that becomes even a bigger problem. So we try our best to reach out to them and do whatever we can. So the senior citizens is a larger population that we cater to.
60 to 70% of your patients are seniors. And I'm sure you mentioned about the fact that you are a second generation dentist and your father's also been into it. From what you have gleaned from him, are there more dental problems now versus what, around the time when your father started? Is that how
So,
the same?
Yeah, so whatever work was done so many years ago by my father, now I'm looking after them, because those patients have become seniors. And so I'm seeing every day in practice upon how maintaining these old treatment done, these old procedures, how they deteriorate if they're not maintained well. So I keep emphasizing on, every time I meet a patient, I'm trying to emphasize more and more upon how they should take care of it. There are many patients who think that, their teeth are just deteriorating and falling off and breaking off, which is not the situation. Had they have maintained all the work done, or over the years, if they looked after themselves, oral health, they would have lasted even longer. So there is this problem of maintenance.
Right. Thank you, Doctor.
My pleasure, sir.
Let me come to you with a question, and this is from somebody who lives in your neighborhood. This is Katie Dadanchi.
Okay.
I think, if I remember right, she lives somewhere near Khusrobagh. But anyway, her question is,
Dadachanji, right?
Doctor, my husband, age 77, needs to undergo cataract surgery. I was informed that dental work or extraction should not be done around that time. I want to know after how many weeks can dental procedures be done after both the cataracts are removed?
There is a coordination with the eye and the oral cavity. So because of which, either ways, and vice versa, we tend not to do any dental work if someone is going for a cataract surgery, or if someone's undergone a cataract surgery, then at least for 2 to 3 weeks, we wouldn't do any major dental work. Fillings or something is manageable, but something like an extraction or a root canal where there is an abscess and there's an infection, that should be avoided to get done post a cataract surgery. At least for a couple of weeks, we should not be doing any work.
Right. Thank you. We have a question from an anonymous attendee. Is there any role of gum stringent in the jaw?
Any role of gum stringent?
Yeah, in sensitive jaw.
Actually, a jaw is not sensitive. It's the teeth that become sensitive. Using a sensitive paste like Sensodyne or a Colgate sensitive paste will help in reducing the sensitivity. There's a very nice paste, Sensodyne Repair and Protect, which can be used therapeutically for maybe 3 to 4 months. And that over a period of time starts coating the teeth, so the teeth start getting lesser sensitive. And apart from it, regular cleaning and mouthwash and rinsing well will definitely help in reducing the sensitivity in the jaw.
Doctor, talking about toothpaste, which is the toothpaste that you would advise people to use? Should you change your toothpaste, ever so often, or should you stick to one type of toothpaste? Is it good to have, say, one toothpaste in the morning and one toothpaste in the
night?
What would you advise?
I don't advocate any particular toothpaste as such, because they all are in the market and they all are made to be used equally as much as the other brands are. But at the same time, if someone is suffering from maybe a bleeding gum issue, which is just a general inflammation of gums or bleeding gums, then you have pastes which are meant for and directed towards controlling that factor, like Pepsodent G, there's Parodontax, there is Omnident. So these are the different pastes that are available in the market for bleeding gums. Then you have a problem of sensitivity, which is, I think, one of the most common problems everyone keeps asking about. In such a situation, you have sensitive pastes. There's Sensoform, there's Sensodyne, a lot of sensitive pastes. So I would suggest that you change your paste only if you have these problems. Your dentist will definitely recommend which paste or brand to use. But apart from it, I don't really advocate any particular brand to go for. And you need not change any toothpaste. But yes, you need to change your toothbrush once in every 3 months. Once the bristles are worn out, you need to change your brush.
Right. Thank you. And what about the Dant Manjan, the tooth powders, and the Datun, etc.
Okay, this is like a little deeper history. I'll go back to earlier. Our seniors were a lot more healthier. The whole natural integrity of the health was a lot more different than what it is today. Today we see teeth which are not as strong as what a senior person back in the day would have. Using this Dant Manjan and powders basically has these silica and these abrasives. Abrasives are not good in today's time or otherwise also, because they tend to wear out our enamel even faster. We are in such a hurry every day that we tend to scrub a lot more. Dant Manjan or any of these powders will basically erode the enamel even quicker. So I would not, I don't really recommend Dant Manjan. But if someone likes the herbal taste or something, you have herbal toothpaste in the market, you could very well use those.
Great. And one last question on toothpaste is, there are some toothpaste which are meant for diabetics, and people say that there's sugar content in the
paste.
Could that be harmful for a diabetic?
Of course, sugar in any way for a diabetic is harmful. What happens is our cheeks, our soft tissues in the mouth, they all absorb whatever there is. So for example, if someone's doing salt water rinsing every day, which is a very good, people have been doing it because of the whole pandemic, people start doing it all the more. Someone who has a blood pressure problem should not be doing salt water, because inadvertently our body absorbs that much of salt, which is not good for a person who has blood pressure problems or with heart condition. Similarly, with diabetes, if you're using a paste with a higher sugar content, it should be avoided because that much more sugar is getting absorbed. Unknowingly, it is maybe a very minuscule value, but doing it twice a day and doing it every day is adding on to your sugar levels. So that you can change, and you can use toothpastes which are with less sugar content or sugar free, like for the diabetics.
Right. Thank you, doctor. This
My
is
pleasure, sir.
very deep dive into toothpaste, but I guess it's all about very basics. Basic.
Yes, and these make a lot of difference in every day because it's something that we do every day, and these are the small pointers that can make a bigger change.
Right. We have a question from Dr. Santa Maria, who's asked, do gums take the place of teeth after they fall in the old age?
Do gums
Take the place of teeth after the teeth fall?
No, so gums is basically a foundation. Tooth becomes your building standing on that foundation. So if the tooth comes off, the gum is just going to be as it is and it will close. There is no tooth which is regrowing, and what is below the gum is your bone. So if you don't have it replaced, the bone starts resorbing and you will lose that bone over there, which will become difficult to replace or to correct later on. So that gums basically, they just cover up and they're just there.
Doctor, there's a question from Mr. A.K. Chopra, Mr. Anil Kumar Chopra, who's 73.
Yes.
What is the life of implants and what type of implants are available? Which one is the best?
Life of implants, 99% they never fail. Implants can go on as long as your bone is healthy. Implants is something that is a substitute for a natural root, which is basically anchored into the bone, right? So as long as someone doesn't undergo any bone changes, for example, osteoporosis, arthritis, diabetes for that matter, diabetes makes your bone very soft. So a lot of diabetics have loose teeth because of the gum being not healthy. In such cases, implants become a challenge, becomes a question mark, becomes sometimes a contraindication that it should not be placed. They may not last. However, coming to the question specifically on how long the life of the implants, they could go on as long as you're healthy and your bone is fine. There will be no problem with your dental implants. Dental implants are a various number in the market today. From back in the day, now there are a number of companies that produce implants and they prepare these implants. I'm not going to name one or two which are the best ones, because all implants are good implants. The dentist will choose the best implant that suits your case the most.
Right. Thank you. We have another question from an anonymous attendee who asks, once a tooth decay is noticed, how soon should one visit a dentist, especially if a person is out of his hometown?
If you're out of hometown and you still have an option to go and visit someone wherever you are, but it should be done at the earliest as possible, because as every individual being different, the chances of the tooth decay increasing rapidly is also one factor. So it should not be something that you overlook or wait till you feel some discomfort that you go visit the dentist. By that time, it could have gone even deeper than when you first saw it, and that could lead to a root canal stage, which could have been avoided had the patient reached the doctor in time.
Doctor, that brings me to a question which I've asked other specialists who have come here. Is that these days when you go to a dentist, the tendency is to have more root canal surgeries than cavity fillings, which would exist earlier. Is that a trend? Is that something that you feel which is better?
No, it's not a mandate that you have to do a root canal. In fact, if it is avoidable, it is even better. But a dental problem I mentioned before in my talk as well is something that we don't really realize till the discomfort kicks in. So even if you have a cavity, it's not bothering us at the moment. So we just don't know what is happening into our mouth. because we don't look into our mouth that often as much as we look into over our body. So that's why visiting the dentist is periodically is more important. So you can catch on to these cavities before they reach into a root canal stage. Cavity starts from a little speck of germ or decay, and it travels to the blood center of the tooth, which is the pulp. So now bacteria has to thrive on something for themselves, like nutrition. Their nutrition is blood supply. So that is how it starts going deeper into the tooth, where it reaches a stage, it's beyond the filling stage, and it goes into a root canal stage. So that is why probably people being busy nowadays don't get the time to get to the dentist in time. And so it leads to more root canals than what it used to be before. But that practice hasn't changed from back in the day to today. It's just that patients end up coming later stages in the cavities that tend to go into root canal stage.
So, doctor, just as one does, blood work, you take an X-ray, you do ECG, etc., on a periodic basis, is there something that one can do which is an X-ray of your teeth, of your gums, your jaws, so that you get to know if there is something that needs attention, and you don't really have to wait for a decay situation?
Right. Of course, once a year, you can always get an X-ray, a full mouth X-ray done, just to see on how the bone condition is. Gums are basically not seen in any X-rays. X-rays show us hard tissue, which is basically bones, the teeth. And in that X-ray, if we find some infection cropping up somewhere, patient actually feels the discomfort first. Thirdly is visiting the dentist is the best, because he or she is the one who's going to advise you to get these mandatory checks done at least once annually.
Doctor, we are getting close to our time, but we have a few questions. If you don't mind, can I ask?
Sure. Please do.
So this is from Narendra Shah, 71. He says, I have had both knee replacements. What precautions should I take before dental treatment, like removal of teeth and root canal?
There is no particular precaution that you need to take after doing knee surgeries. You can go ahead and do your root canal treatment or your extractions if need to, without a problem.
Right. And there is Suresh Khate, who's 70. He has undergone a heart valve replacement surgery, an open heart surgery back. The dentist has advised implant for all 4 missing teeth. 2 number teeth have been extracted 4 months back with advice from cardiologist. He is under blood thinning tablets, Ecosprin 75, as well as acetron 2 mg, 3 mg
Right.
day and 4 mg on every Thursday. Dentist says it's now time for implants.
With someone undergoing a very recent history of open heart surgeries, shall definitely wait for some time to get into doing the implants. He or she has already just had this surgery done just 8 months ago. The cardiologist should give a written consent to the patient or to the dentist that he or she is fit to undergo any kind of implant work, because implants are surgical procedures where Ecosprin has to be stopped at least 2 or 3 days before the surgery and 2 or 3 days after the surgery to avoid any kind of bleeding. In such a situation, if I feel this is quite too soon to go in to do the implants, but if the cardiologists give the consent to go ahead, should be not a problem. But I would suggest to wait for some time more and then go in for implants.
Right. Thank you. We have a question from Rama Gopalkrishnan, who says, if when we have selective fixed dentures in gaps between natural teeth, is it good to remove all teeth and go for a totally new set of dentures? As cleaning is better that way, or by removing dentures after every meal and then wearing them again?
I wouldn't suggest extraction of teeth where it's not necessary. If your bridges and caps are holding on properly, just maintain them. There's nothing like fixed teeth in the mouth. The dentures take some time to get used to, but you will still not have that same feeling that you have with fixed teeth, because when we wear dentures, we cover the palate, and for the lowers, it sits on the floor of our mouth. So basically, our tongue keeps playing around with the denture, and because our palate is covered, the taste of food, what I have got a feedback from senior patients who have been wearing dentures for a while, that you can't taste the food as much because the palate is covered with complete dentures. Also, it is not advisable to have teeth extracted where it is not necessary. It is just a thought. Even I have had these questions in the clinic. Just remove all my teeth and we'll have a fixed denture, which is not the cause. It's not the solution to the problem. In the long run, you'll have more bone loss than what you would have with caps and bridges. So please keep your teeth in the mouth.
Thank you. We have a question from Amit Banerjee. Mr. Banerjee, if suddenly the frontal teeth get hit accidentally and subsequently it pains on a prolonged basis, what can be done?
Accident case scenario is basically trauma to the tooth. The trauma to the tooth may lead to, is definitely directly related to the blood supply. That's the pulp center of the tooth. That leads to an abscess or some kind of dental pathology. It has to be checked out immediately. It should not be something that you're sitting upon, and that tooth will get infected. It probably has already started getting infected since the accident has happened, and root canal and a crown becomes your first step of line of treatment. Over a period of time, a neglected tooth like this starts becoming brown, blue, or pink. So it should not be something that should be neglected.
Right. Thank you, Doctor. We have one last question. This is from Mr. Mohan Krishnan, who says, I get an annual dental checkup done. Is that okay? Or,
yes,
what,
it is okay.
or does that, in what health conditions should one look at having dental checkups more often than just the annual checkup?
See, I did mention something upon plaque and tartar, right? We all know what plaque and tartar is. Plaque and tartar keeps growing inevitably every day in our mouth. So at least an annual checkup is a reason to get to the dentist to have your dental cleaning done, a scaling procedure where everything is cleaned out, your gum health is looked after, at the same time all the teeth are looked into, and then you're noticed if anything is going wrong or is expected to go wrong in the near future. So an annual checkup is a very good habit and it should be continued.
Right. Thank you, Doctor, for taking time off on a Saturday evening.
Thank you very much for having me. It's always a pleasure.
Before we leave, I'm going to show our readers and viewers who are there here just now a sneak peek into our latest issue. Today is the 14th of January, and we have the latest issue of Seniors Today magazine, which is going to be out, which is going to be published today. So this is the magazine. We have a detailed travelogue by Mrs. Archana Mariwala on the frozen continent. And so this is a travelogue of her recent, as she calls it, adventure of a lifetime to the Antarctica.
I'm sure.
And, apart from that, we have a great story on Ramanand Sagar, who made Ramayana, but apart from that, made several films before that. And of course, our usual set of articles that you always enjoy, the tribute to Pele, who passed away last month. So this is going to be available on seniorstoday.in in a few hours from now. You can access it there. You can access the PDFs, and as we all know, these are free of cost, and you don't really have to pay anything for it. Just enjoy. This is issue number 43. You can enjoy all the issues that we've published so far, the 42 issues that we published so far. And as I said, once again, they are all available free of cost. Thank you once again.
Thank you for having me, Pradyuman.
And we would love to have you again, not have to wait for 3 years to do
that. Hopefully not this time.
and have a good weekend. And all of you, we'll
You
be
too.
back next Saturday at 5 p.m. for another session of Health Live at Seniors Way. Thank you very much.
Thank you very much.
Subscribe now and press the bell icon. Never miss an update.